Good evening, everyone. Welcome to Vayomanasa Sanjeevani Monday Webinar Series. Today, topic of the day is stroke awareness. To talk about this, we have Dr. Subhashree Ramakrishnan with us. I welcome Dr. Subhashree. And today's moderator for the session is Mrs. Annapurni. For introducing her, she is doing fellowship in Geriatric Mental Health and Nursing in NIMHANS. I welcome Annapurni. With that, I welcome all the YouTube and Zoom participants to the session. On to you, Annapurni.
A very sweet good evening to you all. The Monday webinar, today's topic is on stroke awareness, which is the most common cause of death among the elderly. And as we know, people are more with hypertension and diabetes has been an upcoming, and most of the people are affected with such a disease conditions. And here we have an expert in hand, Dr. Subhashree Ramakrishnan. She is an additional professor in Department of Neurology in NIMHANS, and she spent her valuable time with us in explaining about the stroke awareness to us. Please, ma'am, you can start the session.
Very good afternoon, everybody. Thank you for the opportunity. So I am Dr. Subhashree. I am working in the Department of Neurology in NIMHANS. I have my experience in stroke and cognitive disorders. So this whole of October was considered as the World Stroke Month, and October 29th was celebrated as the World Stroke Day. So every year this is being celebrated throughout the world, mainly to increase the awareness of stroke and also to ensure early identification and proper approach to medical care, thereby preventing and improving stroke prevention and proper care. So this year's theme is minutes can save lives, or it is also mentioned as #precious time. So that is the theme for this year. So with this background, let me just walk you through some of the important things which are essential in understanding about stroke. Kindly stop me if there are any queries, or if there is any other questions, kindly feel free to stop me.
Thank you so much, Pavitra, for that wonderful introduction. So before we jump into discussing more about wisdom circle, I'm wearing in the tourism department. Only tourism department is supposed to coordinate with forests, because all the ecotourism is dependent on forests. Forest on you, please.
Shall I continue, or?
Yes. Okay. Yes, ma'am. Yes, ma'am.
Yeah,
you can.
Fine. Okay. So first and foremost, let me tell you what is stroke. So as per the scientific definition, it is a rapidly developing clinical sign of focal disturbance of the cerebral function, which lasts more than 24 hours. Basically, what it means, more than one day, there has to be a focal disturbance of the brain function. Focal disturbance may be weakness of one hand and leg, or it could be transient difficulty in talking, transient difficulty in swallowing, or it could be facial deviation. Somebody must be eating, suddenly there may be drooping of angle of mouth, or suddenly somebody is not able to walk, suddenly somebody is having loss of balance while walking, or suddenly someone lapses into altered sensorium, he's comatose, not responding to any commands. So such a rapid, so somebody was talking, somebody was eating, somebody was working, and then the family would say that suddenly he developed a sign of focal weakness or slurring of speech or visual problem. So sudden dysfunction of the brain, which is lasting for more than 24 hours. We say when it is lasting less than 24 hours, we use the term mini stroke or we use the term transient ischemic attack. And mainly this is because of the vascular origin. Vascular means we say that it is because of the blood vessels, the blood pipes. And with more and as the years are growing, more and more studies have shown that there is a very gross increase in the number of patients or subjects who are suffering from stroke. And in India also, urban areas, there is increase in the number of strokes every year, more so in the Asian countries because of increased BP and cholesterol. And as on date, stroke is one of the third cause of death in India and the first cause of disability in India. And as we are talking, a stroke occurs every 40 seconds and somebody dies of stroke every 4 minutes. So that's the impact of stroke, and half of all strokes in India can be attributed to raised BP. So a simple blood pressure monitoring itself is very, very important. And 1 in 6 die of stroke in lifetime. So that's the burden of stroke, and that's the importance of understanding about stroke. Now there are two types. One is called as the arterial stroke, other is called as the venous stroke. Arterial means the blood pipe that is carrying good blood, and venous is a blood pipe that is carrying the non-oxygenated, so blood which doesn't have oxygen in it. So venous, that is venous. Now under arterial strokes, we have two types, that is called ischemic or thrombotic, and which is the commonest one, which makes up to 85% of strokes. Then in the remaining 15%, it is called hemorrhagic stroke. So ischemic stroke means a blood clot. There is a clot within the blood pipe which is going in blocking the blood pipe. Whereas in hemorrhagic stroke, there is a rupture of the blood vessel. So mainly because of high BP, the blood pipe opens up. That is hemorrhagic stroke. So these are the two types of strokes. So on the left side, you can see that these are the blood pipes that are running from the heart in the neck towards the brain. So if they are getting blocked, some blood clot which moves and it blocks, then we get something called as ischemic stroke. And on the right side, you can see that there is a bleed. So there is a white thing on the CT scan. That's the CT scan. That is the brain imaging where there is a leakage of blood. So that is mainly because the blood pipe has ruptured. So it is important to understand these types because the treatment of each type is very different. And as I mentioned, one has to understand about the symptoms of stroke. So it can be anything starting from weakness of one hand, one leg, or weakness of both the hands, both the legs, inability to walk, loss of imbalance and balance and coordination, trouble with speaking, or trouble seeing on one eye or both the eyes, or suddenly somebody may have numbness of one hand, one leg, or face. So these are some of the symptoms which one should understand about stroke. And 25% of the neurological emergency in NIMHANS is stroke. So as I mentioned earlier, this is a small term which we can remember. B fast. B for balance, loss of balance. E for eyes, sudden visual blurring of vision or transient visual loss. And fast. F for supposing you ask the person, you doubt that that person is having stroke. You tell them, you show your teeth and smile. So if the nasolabial fold, what we say is the angle of the mouth, if there is a drooping, they are not able to smile properly. So facial drooping, if that is there. Then arms, you can ask the person to lift if he's in a better position to understand, you can ask them to lift the hand and the hand will suddenly drift down. And speech, there can be slurring of speech. And if you see all this, then you should understand that it is time to call. And a headache on top of that is also will help you to understand that the person is suffering from stroke. So this is a very common thing which everybody should know, that because it is important to identify at the right time. Now, sorry.
Yes, ma'am, you can go ahead.
Okay. Now, what are the risk factors? Now, who will get stroke? So, it's a very common thing, the high blood pressure. So, high blood pressure, smoking, alcoholism, or obesity, lack of physical activity, diabetes, then increased age, previous stroke or minor strokes, then other heart disorders like congenital heart disease or atrial fibrillation, then some women on puerperal stage, hormonal or contraceptive pills, and then substance abuse, stressors. So many other things, so many things are called as risk factors for stroke. So these are the people who are more prone to have stroke. Some are modifiable, some are not modifiable. Say, for example, the ethnicity, the genetics, the family history, these are not modifiable. Whereas the remaining ones, so nutritional deficiency, B12, folate deficiency, or if it is diabetes, proper control of diabetes, or if there are heart disease, or if there is any oral obesity. So these are called as modifiable risk factors. So some can be modified, some cannot be modified. So as I mentioned, I just want to emphasize again and again, because these are the simple things which can prevent a major event. So blood pressure monitoring, monitoring of sugars, and then avoidance of drugs and alcohol, avoidance of a certain type of food which is more in salt, food which is more in sugar. So avoidance of those, proper identification of heart disease, and then proper identification of associated comorbidities. So presence of asthma or lung disease, which can in fact affect the outcome of the disease. Then presence of environmental factors, then cholesterol, overweight. So many things, these are all linked up, and these are all called as the risk factors for stroke. Now, how is stroke diagnosed? So as I mentioned earlier, these are the symptoms. Then once the person comes to emergency, there are a set of neurological examination which the doctor would perform, and then would, after stabilizing the person, so his BP, his pulse, his breathing, everything will be stabilized, and then the person will be subjected to brain imaging. So brain imaging can be CT scan or MRI, and a list of blood investigations may also be asked. So early identification is very, very important, and stroke kills around even a minute. If it is lapsed, then 2 million neurons are died, and the brain would age by around 3.6 years per hour. So that is the importance. And in Bangalore itself, up to 5 cases of acute stroke suffering happens every day. So that's the importance of early identification, early arrival to the hospital. So this is one of the image where you can, these are all images where we see how, this is how a doctor would see, and see whether it is blood leakage or whether it is blood blockage. And there are several advanced images that are now available, with which we can even understand how much brain is affected and dying, of how much is already dead. So that all can be understood by several advanced images. And so with regards to acute stroke management, so I want to emphasize this particular thing, because that is the theme for this year, acute ischemic stroke. So generally within 3 hours or even before 4.5 hours, what we do is, once the patient is stabilized, then we advise them to undergo a CT scan. So if CT scan is showing blood leakage, or if there is a blockage, so if there is a leakage, that is hemorrhagic stroke, then the treatment is different. Whereas if there is a blockage of blood circulation and a large vessel, large pipe is blocked, then what we do is, we would advise them to undergo IV thrombolysis or mechanical thrombectomy, which means IV thrombolysis means there are some drugs which can be given through the blood vessels intravenous, as a bottle, as an infusion. We will be giving them if they come to the hospital right on time, within 3 to 4.5 hours. So with the advent of all these IV therapy and then mechanical thrombectomy, these are all very much time dependent. So if they are coming early to the hospital, then the chances that the blood circulation gets reperfused it gets the supply back immediately. So outcome is also better. So that is what we call it as golden hour. So the first 1 hour after identifying stroke. So if someone is brought to the hospital and within 1 hour he is able to get the treatment, then these are the patients who are having a good outcome. So that's the whole important thing, precious time. So no point in wasting time. Once you identify that someone is suffering from these symptoms, he has to be brought to the hospital immediately. Not everyone would be eligible for this therapy, but then there is a checklist we can run through. We can say who are all eligible, and then we can advise them the therapy. Now, why that is important? So the red one, what you're seeing is the tissue that is infarcted. Now there is a yellow outside that. So that is the tissue that is dying. So we can save that tissue. The earlier they come, that tissue can be saved, and the damage of the brain can be saved. So studies have shown that even 1 minute, then several millions and billions of nerve fibers are getting damaged. So time saved is brain saved. And so that is why it is important pre-hospital. So calling up an ambulance. So suddenly you find someone is having those symptoms, immediately calling 108 and using the pre-hospital system to come to the hospital, which is stroke ready hospital. That is very, very important. So public education in this aspect is important. And then we run through a checklist of who are all eligible, who cannot undergo thrombolysis, and then we advise regarding the treatment. So these are some of the drugs. It's called alteplase and tenecteplase. So these are some of the drugs which are given in an IV infusion for stroke thrombolysis. Then there is also mechanical thrombectomy. So supposing somebody comes after 4.5 hours, but within 24 hours, then also there are several treatment modalities. Things have changed and evolved over the years. There are stents and retrievers and fibrolysis. So many techniques and advanced modalities have come now. So here you can see that basically blood pipes are closed on the left side, whereas after removing the thrombus, you can see a small red one on the down. So once that is removed, the pipes have opened up. So same here on the left side, and then on the right side, you can see that the blood vessels have opened up after treating them. So those are one modality of treatment when the person is brought to hospital at an earlier time. So mechanical thrombectomy, we give even up to 24 hours, and thrombolysis is done between 3 to 4.5 hours. Now, what about others? So in other conditions, so when they are coming after 24 hours, then there are several other treatments, like there are some medications called aspirin, clopidogrel. Then there are some surgical procedures like endarterectomy in specific cases where some blood pipes are blocked. Then there is a other type. So these are all for the ischemic stroke, when blood circulation is blocking. Now what happens when blood is leaking? So that is the hemorrhagic stroke. So there are several surgical procedures. The neurosurgeon will find out what is the cause for the bleed, whether it is BP, whether it is some other, the arterial and the vein pipes are getting connected. So they will find out, and accordingly there are several treatment options. That is about the arterial stroke. We saw arterial stroke, ischemic and hemorrhagic. Now there is one more type called as the venous stroke. So this is commonly seen in postpartum women, or in male gender, it is common in people who have alcoholism, binge alcohol intake,
Yes, sorry for the inconvenience. There is a network issue. We'll resolve it within a minute.
I'm sorry, some network issues. I'm logged in
Network
from the
problem.
mobile.
Network problem from the guest or host area.
I don't know, it is NIMHANS Wi-Fi. I've connected from the NIMHANS Wi-Fi only. So
Okay, okay. Yeah, that's all. But your voice is heard now.
So now I've logged in from my mobile.
Okay,
The
okay.
NIMHANS the NIMHANS Wi-Fi suddenly stopped. That is why. Sorry, I'll not be able to show the slides then.
We are hearing. You can continue.
Okay, okay. Yeah. So I wanted to show some slides also. Anyway, I will just tell whatever the contents are there in the slide. So basically, it requires a stroke-ready hospital, and it requires a team. So it is not only neurologist; it is a healthcare physician. Then there has to be neuroradiologist. Then there should be team of physiotherapy, occupational therapists, psychiatrists, and then psychiatric social workers, speech and language pathologists. So there's an entire team of specialty stroke care team that has to be involved in the care of this. And stroke ready hospital means it's a stroke emergency ready hospital. So for a dedicated focused 24/7 ability to administer these clot busting medications which I was mentioning earlier, and mechanical trauma. That is the stroke ready hospital. And so once the person gets stroke, so the clinical neurologist or the physicians, they will be involved in the care of the patient, stabilizing the person, and then identifying who will have to undergo the IV thrombolysis or mechanical thrombectomy, or to identify who will not be benefiting from these. Then in them to identify what other treatment, medical management can be given, and how to reduce the BP, how to monitor the blood sugars and the electrolyte imbalances. So management of their positioning, infection control. So that all will be by the medical. After the acute stage, then once we have a different type, sizes are important for the help in the reorganization. It will help in the neuroplasticity. One part of the brain is affected. Now the rest of the brain will come to help the remaining affected brain, and it is important in helping making them independent. So the person is no more able to do his own daily activities, so he has to start doing his daily activities. For that, post-stroke exercises are important. So these are taught by the physiotherapist, and it is advised that they do it in social groups or community, and then they should be committed for that, so that it will help them to become independent and also reduce their mood depression associated with stroke. Now, what should not be done in stroke physiotherapy is, supposing somebody has pain, then they cannot exercises to strain the tissue and muscle. So in that case, we cannot strain that exercise or that joint. Now, whatever adequate uh, they are able to do in their fatigue level, their ability, that has to be assessed, and that has to be given. Or somebody is having a slipped shoulder, then we cannot pull on that shoulder. So these all instructions have to be given to the patient and the caregiver also. So there are posters that are made by the Department of Physiotherapy. Because of this technical glitch, I am not able to share all that. I can share that subsequently, which is made by the for World Stroke Day. A list of a lot of patient education material has been made by different departments of NIMHANS, starting from physiotherapy, occupational therapy, pathologists, and then the different departments. They have made educational posters. I can share it across later. I'm not able to share now because of this technical glitch and the internet difficulty. Now, so that is about the physiotherapy. Now, what about orthotic management? So, from the occupational therapy point of view, so their aim is proper limb positioning, prevention of deformities or joint luxation, and reducing pain. So, one hand, one leg is not working. So, how better it can be improved without pain? So, for that, there is a lot of upper limb and lower limb orthosis, so ankle orthosis, wrist orthosis, knee braces. So all these are there mainly to prevent foot drop, enhance the weight bearing and stability. For that, these are the orthotics available. Not only that, they have come up with several innovative ideas like one hand technique. So one hand only is working for them. So they have come up with one hand techniques. And then there are several adaptive and functional. So hand functions are there, range of movement improvement, weight bearing and tongue control measures are there. And then electrical brushes or adaptive instruments are also made for occupational therapy of these stroke subjects, and that is available at NIMHANS also. Then another important thing is swallowing. At least half of them with stroke will have swallowing difficulty, and it is very important to identify that, because if someone has swallowing difficulty and he is taking anything orally, there is a chance that he may aspirate, or there is a chance that he may choke. So that has to be identified properly, and there is a dedicated team of swallowing and speech and language assessment team at NIMHANS, and generally they can also help in rehabilitation of swallowing, and speech therapy also is also another important aspect, because stroke patients can be left behind with aphasia. That is, they may not be able to understand, or they may not be able to read, write, or talk. So that also requires early intervention and identification and rehabilitation, speech therapy, that can also help them in aphasia management. So with that, then there is a role of psychosocial intervention. So lifestyle modification. So somebody has got stroke. Now he should not get it again. So there are preventive measures. So lifestyle modification, avoidance of alcohol, avoidance of smoking, etc. So those lifestyle modification, then psychoeducation, motivational and behavioral support, family care and caregiver burden management, all that is taken care by psychiatric social workers also. Now, with that, this all will be rehabilitation of stroke subjects. Then stroke prevention. So how to prevent stroke? 80% of the time, stroke can be prevented also. So one simple measure is measuring BP, regular monitoring of blood pressure, then monitoring of blood sugars, managing the diet, regular exercises, stopping smoking, stopping and quitting alcohol intake, and then identifying cardiac issues like atrial fibrillation, or identifying any cholesterol abnormalities. So all these are some of the simple steps which can be carried out to prevent stroke. So these are the, and proper adequate diet, low in sodium, and adequate plenty of fruits and vegetables, and active lifestyle. So all this can help in stroke management and stroke prevention also. So these are the things. There are several stroke awareness videos that has been released. Professor Girish Kulkarni, who is the leading the stroke team at NIMHANS, along with the UK team, they have come up with several stroke awareness videos and links which are in Kannada also. So I can share with the team, and maybe I can give it along, and that can be passed on and can be looked in as well. So this is what I wanted to convey on stroke awareness. And I'm sorry for the technical glitch. I'm not sure why I'm not able to connect to the Wi-Fi again.
Yeah, that's fine, ma'am. Now the floor is open for discussion, and I request the participants, you can share your doubts or thing to our beloved madam. Yes, please.
Doctor, good evening.
Yeah, good evening, sir.
I am Tangaraju speaking.
Okay.
One thing, shoulder pain or back pain like that due to age problem. They are referring to ortho doctors. Initially, physiotherapy, ortho doctor, like that, the treatment is going on like that. Whether we have to consult a neuro surgeon or neuro physician for pain in the right shoulder and left shoulder like that, or back pain, whether it affect the as you spoken in this subject. Thank you, Doctor.
Yeah. So there are two different things. Now, whether we are talking about stroke and related pain. So if it is stroke, subjects with stroke can also have pain in the limbs. So some of them where some parts of the brain, say for example, it's called thalamic involvement. So when they will have severe pain of the affected hands and legs. In that condition, yes, the neurologist will deal with that. But otherwise, when you are saying only a generalized pain, whether it is hand pain or any joint pain, then it is a physician or an orthopedician. If it is confined to a joint or any bony prominences, or if it is a generalized pain, then it is dealt generally by a physician or an orthopedician. Whereas a neurologist, it will be if it is in the distribution of our nerves, or based upon the distribution, we will assess what is the type of pain, whether it is a neuromuscular pain or whether it is coming from the nerves. So based on that, we will understand, and then we'll be managing. Generally, if it is a diffuse pain, if it is confined to, say, supposing someone is having shoulder pain or a knee pain, then that is generally dealt by a physician or a orthopedician. After stroke, if it is pain, then that is definitely dealt by a neurophysician.
But my question is preventive. I would like to consult NIMHANS like you or in your department for to get more information about the health.
Yes, sir.
Because after getting deteriorated, then the patient has to admit in NIMHANS or neuro centers like that.
Yes, sir. Yeah, prevention of stroke. That is what I'm mentioning here. Prevention of pain. Is that what you're asking? Prevention.
Yes, prevention of pain.
Prevention of pain is again lifestyle modification. So to keep oneself more active.
Foot pain like that. Foot is also some part of blood circulation.
Yes, sir. So one is with more and more of aging. Yes, sir. With aging, one has to screen for diabetes. So diabetes is one cause. Then all the vascular risk factors.
All problems we are having. Diabetes and the BP, heart problem. These are all combined more than 75 years. Even above 60, we are facing all these things. Diabetes is generally affected, and blood pressure is also. Then yes, food practice also. Normally, we could not avoid some interruptions in marriages and like functions like that. Anyway, these are all combined issues facing the senior citizens.
Yes, sir. That
I
is
think
why.
you are understanding our seniors' problems.
Yes, sir. Yes, sir. That is why I want to emphasize on prevention. So
Yes,
we
sir.
all understand, we all know that diabetes is there, hypertension. But what is there is we accept it. We say, it is there. So just like you
Yes, sir.
said, it is there. We are living with it. Yes, we are
Yes.
living with it. But then it has to be monitored. It has to be under control, and proper medications has to be taken, because if drug compliance is taken,
we are doing
walking,
walking.
physical activity. So
Yes.
for some, it may be walking, for some, it may be swimming. So it can be whatever physical activity, at least 30 minutes for five days a week. So some physical activity, if it is kept, and then proper compliance to the medications, regular monitoring, if that can be adhered to, then one can prevent the occurrence of stroke itself. Because stroke is such devastating thing, not only for the family, not only for the person, for the family also. So such a devastating thing. So in order to prevent that, I think it is important for monitoring these preventive risk factors, which you were also pointing out.
Thank you, doctor. Thank you, doctor.
Yes, Mrs. Shakuntala has raised her hand.
Yes, doctor. Like, I just wanted to know, we heard about the golden hour. Like,
Yes.
as soon as the patient get the treatment in that period, the stroke can be reversed back. Like I just wanted to know more about it, doctor.
Yeah, so this is only a subset of people. So around 8 in 1 people may come in the golden hour. So it's not that everybody come in the golden hour. Pre-hospital setting is also very important. So somebody has to identify that the person is having stroke, and then they have to be brought on right on time, specifically within 4.5 hours. Ideally, it can be 3 hours, and more so if it is in the first 1 hour. If they come, then there is a checklist that we would go through. So whether they are having high BP, whether there is no bleeding, there is no prior disability. So we'll go through the checklist and we'll see whether the person is eligible for that therapy. So there are 2 types of therapy, which I was mentioning. Within 3 hours, we give something called intravenous thrombolysis. So there are some drugs that are available now, and that can be given as a IV infusion. So after that, if they are fulfilling the criteria, if they're eligible, then we give them that drug, and then in 1/3 of them, they may completely improve. So the person may be having weakness of hand and leg, and then the weakness may completely improve also. In 1/3 of them, the drug may not do anything. They will just remain the same. And in 1/3 of them, there can be some other complications. Some bleeding can happen in the brain, or some other complications can also happen because of the drug. So this is called as intravenous thrombolysis. Then if somebody is coming within 1 day, 24 hours, if they are coming, there is something called mechanical thrombectomy. So that is generally done by the interventional radiologist. So that's a teamwork, and so when they do it, it's a teamwork, and interventional radiologists, they are involved, and the thrombus is removed, and then the persons there also, they may improve or they may remain same also. So these are some of the treatment modalities for the golden hour, if they come within 1 hour or if they come within 4.5 hours. So this is all acute stroke management, and that is why we want to emphasize time is brain and precious time. I think I have answered your question.
Yeah. Thank you, doctor. Thank you. And one more thing, usually the stroke affected people, as soon as they are discharged from the hospital, they go to some places, like, I don't know, they go for the treatment and all. How good is that? Is it effective?
Some of them propagate that they are good. They say massage therapy and this and that. So what is important is proper drug compliance. They have to take the proper treatment that is advised by the doctor. They have to ensure that their BP sugars are under control, and the mobility of the hands and legs, that has to be taken care of. So for that, they have to ensure that the affected arms don't get stiffened and contraction. So for that, physiotherapy is important. So to keep the arms and leg in a good condition, physiotherapy is important. But this massage and other things, they should not be done in such a way that there can be subluxation of the joint itself. So all that has to be properly done by a qualified person. There should not be any, it has to be done by a qualified professional, then it is different. Otherwise, I would not like to comment on where I am not an expert in that.
Madam,
It is.
Thank you, doctor. Thanks a lot. Yeah.
Madam, ನಾನು ಕನ್ನಡ
ಹೇಳ್ಬೋದಮ್ಮ. ಮ್ಯೂಟ್ ಅಲ್ಲಿ ಇದ್ದೀರಾ, ನಿಮ್ದು ಮ್ಯೂಟ್ ಆಗ್ಬಿಟ್ಟಿದೆ.
ಈಗ 15 ವರ್ಷದಿಂದ ನನಗೆ ಬಲಗೈ ಬಲಗಾಲು ಬಾಯಿ ಎಲ್ಲ ಇದಾಗಿತ್ತು, ಹೋಗ್ತಾರ ಎಲ್ಲ ಅದೇ ಹೇಳ್ದಾಗ ನಿಮ್ಯಾನ್ಸ್ ಎಲ್ಲ ಇಟ್ಕೊಟ್ರು, ಔಷಧಿ ಮಾತ್ರೆ ಎಲ್ಲ ಕೊಟ್ಟಿದ್ರು. ಜೊತೆಗೆ ನೀವು ಹೇಳ್ದಾಗ ನೇಚುರೋಪತಿ, ಮಸಾಜು, ಫಿಸಿಯೋಥೆರಪಿ ಅದೆಲ್ಲ ಮುಗಿಸ್ದೆ. ಈಗ್ಲೂನು ಚಳಿ ಆದ್ರೆ ನೋಡಿ ಈ ಕೈ ತುಂಬಾ ಇದಾಗುತ್ತೆ, ಮತ್ತೆ ಕಾಲು ಹಿಂಗ್ ಹೋಗುತ್ತೆ. ಭಯ ಆದ್ರೆ ಮಾತು ಸ್ವಲ್ಪ ಇದಾಗುತ್ತೆ. ಏನ್ ಮಾಡ್ಬೇಕು?
ಭಯ ಆದ್ರೆ ಏನಾಗುತ್ತೆ?
ಮಾತು ತೊದ್ಲುತ್ತೆ, ಇಲ್ಲಾಂದ್ರೆ ಧ್ವನಿ ಬರೋದಿಲ್ಲ.
ಮಾತು ತೊದ್ಲುತ್ತಾ? ಒಂದೊಂದ್ ಟೈಮ್ ಮಾತು ತೊದ್ಲಾಗುತ್ತ ಅಂತ?
ಹೌದು.
ಅಲ್ಲ, ಮಾತು ತೊದ್ಲುತ್ತೆ ಆದ್ರೆ ಬಂದ್ ನೋಡ್ಬೇಕಾಗುತ್ತೆ. ಯಾಕಂದ್ರೆ ಒಂದ್ಸಲ ಲಕ್ವ ಆಗಿರೋವರೆಗೆ ಮತ್ತೆ ಲಕ್ವ ಆಗೋದಕ್ಕೆ ಸಾಧ್ಯನೂ ಇದೆ. ಭಯ ಆಗೋದಕ್ಕೆ ಅಂತ ಇಲ್ಲ, ನಿಮ್ಗೆ ಭಯ ಆಗೋದಕ್ಕೆ ಅಂತ ಹೇಳ್ತಾ ಇಲ್ಲ, ಬಟ್ ತುಂಬಾ ಕೇರ್ ತಗೋಬೇಕು. ನೀವು ಮಾತು ತೊದಲ್ತಾ ಇದೆ ಆದ್ರೆ ಕೆಲವು ಟೈಮ್ ಬ್ಲಡ್ ಸಪ್ಲೈ ಕಡಿಮೆ ಆದ್ರೂ ಮಾತು ಕಡಿಮೆ ಆಗುತ್ತೆ. ಇಲ್ಲ ನೀವು ಭಯನಲ್ಲಿ ಆನ್ಸೈಟಿ ಅಂತಾರೆ, ಅದ್ರಲ್ಲಿ ಹಂಗಾಗುತ್ತಾ, ಅದು ನಾವು ನೋಡ್ಬೇಕು. ನಿಮ್ಗೆ
ಎಲ್ಲಿಗೆ ಬರ್ಬೇಕು?
ನೀವು OPD ಬರ್ಬೋದು, ನಿಮ್ಹಾನ್ಸ್ OPD ಬರ್ಬೋದು. ಸ್ಟ್ರೋಕ್ ಕ್ಲಿನಿಕ್ ಅಂತಿದೆ. ಸೊ ಸ್ಟ್ರೋಕ್ ಕ್ಲಿನಿಕ್ ಟ್ಯೂಸ್ಡೇಸ್ ಎಲ್ಲ ಸ್ಟ್ರೋಕ್ ಕ್ಲಿನಿಕ್ ಇದೆ OPD ನಲ್ಲಿ, ಹಂಗ್ ಬರ್ಬೋದು.
ಬಂದಿದ್ದೆ ನಾನು ಅವಾಗೆಲ್ಲ.
ಓಕೆ, ಹಂಗೂ ಬರ್ಬೋದು. ನಾವು ಒಂದ್ಸಲ ಚೆಕ್ಅಪ್ ಮಾಡ್ಬೋದು, ನಿಮ್ BP ಹೆಂಗಿದೆ, ನಿಮ್ ಶುಗರ್ ಹೆಂಗಿದೆ. ಮತ್ತೆ
ಶುಗರ್ ಇಲ್ಲ, BP ಇಲ್ಲ.
ಒಂದ್ಸಲ ಬಂದಿರೋವರು ಇನ್ನೂ ಗಮನವಾಗಿ ಇರ್ಬೇಕಾಗುತ್ತೆ. ಸೊ ನೀವು ಹೇಳಿರೋದು ಕರೆಕ್ಟ್ನೇ. ಸೊ ಅದು ಕರೆಕ್ಟ್ ಆಗಿ ನಾವು ಅದು ನೀವು ತೊದಲು ಅಂತ ಹೇಳೋದು ನರ ಕಾಯಿಲೆಗೋಸ್ಕರ ಆಗ್ತಾ ಇದೆಯಾ ಅದು ನೋಡ್ಬೇಕು. ನೋಡಿ ಅದು ಪ್ರಕಾರ
ಚಳಿ ಶೀತ ಮಾಡ್ಕೊಳಕ್ಕಾಗಲ್ಲ, ಚೂರು ಶೀತ ಮಾಡಕ್ಕಾಗಲ್ಲ, ತಣ್ಣೀರೋದು ತಿನ್ನಕ್ಕಾಗಲ್ಲ, ಮತ್ತೆ AC ಇದ್ರೆ ಎಲ್ಲ ಇದಾಗುತ್ತೆ.
ಅದು ನಿಮ್ ಹಳೇದ್ ರಿಪೋರ್ಟ್ ಎಲ್ಲ ನೋಡಿ, ನಿಮ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಎಲ್ಲ ನೋಡ್ಬಿಟ್ಟು ನಾವು ಹೇಳಕ್ಕಾಗುತ್ತೆ. Can I share some of the?
Yes, sure, ma'am.
So this was what I was mentioning. There are a set of exercises which has been suggested by the physiotherapy department. They have made nice exercises, protocol, so task oriented. So somebody has upper limb weakness, so for them how to hold, how to grasp, and then how to walk, so such things. And then home-based exercises. So these are all some of the protocols that they have devised for post-stroke exercises. Then these are the orthoses which I was mentioning, for reducing pain. For they will not be able to, so somebody with lower limb weakness, they will not be able to lift their foot up, so that's called foot drop. So for them there may be ankle foot orthosis that may be required. So then you can see that lady is wearing a hand orthosis and foot orthosis. So there are several such things that are available based on their condition, whether the limb is flail and it is falling down, or whether it is becoming stiffened. So based on that, there are different orthoses that is available in the occupational therapist would help us to understand that. Then there are occupational therapy that was what I was telling. So someone with stroke, so one hand is okay. So to teach him how to use one hand, using one hand, how to wear the shirt, so all that he can. So one hand techniques are there. Then there are adaptive equipments, so button hook holder, glasses. So these are all some of the adaptations that are available. Then to improve their shoulder movement, range of movement, shoulder wheels are there. Then peg boards are there. So they will have fine movement difficulty in the hands, those with stroke. So to improve that, there are peg boards. Then for trunk control, then for kneeling, so functional ability. So they have to get back to their normal positioning, and they should be able to do their activities on their own. So for that, occupational intervention is also available. And then this was what I was mentioning about the swallowing. And these are the QR codes. If you want, if you are interested, you can, this is by our unit head, Professor Gulkani, along with the UK team. They have, and our health education team. So all these videos are available in Kannada. If you are interested, you can scan the QR codes and you can download them, and you can watch on that as well. Somebody had texted on this, so you can take a picture and you can download and you can watch it in Kannada. So I acknowledge the entire stroke team. It is not a one-person show. It is a teamwork, multidisciplinary team. As you can see, I put so many department names, starting from neurology, neurosurgery, psychiatry, psychiatric social worker, intervention radiology, speech therapy. So it's a teamwork. It's a multidisciplinary teamwork. That's so from day one of a stroke care, it starts from day one, first minute onwards, till the person is back to his normal life and he's able to do his daily activities. So that's a teamwork, stroke team. And thank you for your patient listening. Been such an enthusiastic group. You asked quite a few questions, and I'll be happy if I'm able to clear some of your doubts. Thank you. Thank you for the opportunity.
Thank you, ma'am. Like for your good presentation on stroke awareness to the public. And I hope like participants would have been benefited. And like most of them all are here, the participants are above 60 years or old age. And this session would have been very useful for them. As you said, like prevention is better than cure. So like most of them are diabetes and hypertension. Let them keep monitor with their diabetes so that they can prevent stroke in future. And as well, they can educate the relatives and other neighbors also on stroke. And as you said, this is not only affecting the individual, but also the entire family is being affected because of this. And I hope this was a really an effective and educative session for the Zoom participants, VMS participants. Thank you so much, ma'am, for your precious available. And you have made, even though you are very busy, and you have accepted our invitation, and you have just come with us and given a good explanation on stroke. Thank you so much, ma'am. And I also thank the participants, Zoom participants, who have been effectively participating regularly in VMS sessions and asking your doubts and everything. And I hope this was an effective session. And at last, I would like to thank our partners with our Vayomanasa Sanjeevani. Thank to our partners, Government of Karnataka, Indian Psychiatric Society, Karnataka Chapter 1, Karnataka State Legal Service Authority, Bangalore Apartment Federation, Happy 60 Plus, Samadhana Counseling Center, Icon Life Services, our Easy Foundation, and NSE Foundation. Thank you all and have a cheerful evening. Bye.
Thank you.